Now, with this module, we are going to see how we have moral dilemmas, how we can accomplish moral dilemmas by thinking accurately, exactly, and aligning with our personal and professional integrity. So, it is the silent whistleblower, Dr. Anya's moral crossroads. The background of the same: Dr. Anya Sharma, 30, is a bright and compassionate junior doctor working at the government run Community Health Center, CHC. She chose to work in a rural setting out of a strong sense of service and dedication to public health. The CHC is well regarded and serves several surrounding villages, playing a crucial role in providing affordable healthcare to a large, often underprivileged population. The head of the CHC is Dr. Rajesh Kumar, a respected senior physician in the community. He has served for over 20 years, is highly admired by the villagers for his kindness and dedication, and has personally mentored Anya. He is known to have successfully secured crucial government funding and resources for the CHC, for the Community Health Center, improving its facilities over the years. So, here we are going to see how Dr. Anya and Dr. Rakesh Kumar have a conflict involving their personal value system, their professional integrity, and how they try to resolve it and come to a general consensus about it without too much of a misunderstanding, with too much of a friction. Now, the moral dilemma. One evening, while cross referring patient records for a routine audit, Dr. Anya stumbles upon a disturbing pattern. She discovers that Dr. Rajesh Kumar has been consistently overprescribing certain expensive branded antibiotics and medical tests for non critical conditions. Even when cheaper, equally effective, generic alternatives or simpler diagnostic methods would suffice. These prescriptions are often to pharmaceutical representatives from whom he accepts minor gifts, example pens, notepads, occasional sponsored conference attendance, while not directly harming patients or illegal by the letter of the law in all cases. It's a clear breach of medical ethics, specifically prioritizing personal gain, even small ones, over patients' financial well being and optimizing public health resources. Many villagers struggle financially, and these unnecessary expenses are a significant burden on them. Anya feels the weight of two powerful, conflicting moral obligations. The first, duty to patient welfare and medical ethics. The value here is honesty, integrity, and justice. As a doctor, Anya's primary duty is to her patients' well being, which includes their financial health and avoiding unnecessary medical expenses. Her professional code of conduct demands honesty, transparency, and reporting unethical practices. This aligns with her personal sense of integrity and justice for the vulnerable. Loyalty to mentor and community stability. The value is loyalty, gratitude, compassion, community harmony. Dr. Kumar is her mentor and a pillar of the community. Exposing him would not only ruin his reputation and career, he's nearing retirement with an unembellished record, but could also cause immense disruption at the CHC. The villagers trust him implicitly, and a scandal could erode their faith in the institution itself, potentially leading them to seek treatment from less reliable private sources. She also feels a personal debt of gratitude to him. him being her mentor. Now, the internal struggle the Dr. Anya is torn into. Speaking up versus staying silent. If she reports him, example, to the district health officer or medical council, she upholds her ethical duty and protects future patients, but she would betray her mentor, potentially dismantle his life, and risk creating instability in the very community she serves. Individual harm versus collective harm. Is the collective harm of occasional or overprescription, which might not directly cause physical harm, but is a financial burden greater than the individual harm she would inflict on Dr. Kumar and the potential loss of community trust in the CHC? Justice versus compassion. Done justice demand exposing him, or does compassion for his situation and contribution to the community warrant a different approach? Career risk. Whistleblowing, especially against a powerful senior, could negatively impact her own nascent career in a small, interconnected professional community. Possible choices and their immediate moral costs. Option A that she has: report Dr. Kumar officially. Prioritize integrity, justice, patience, and welfare. The moral cost: betrays loyalty, causes immense personal suffering to Dr. Kumar and potentially his family, risk community disruption and loss of trust in the CHC, and potentially her own career as well. Option B: confront Dr. Kumar privately and give an ultimatum, attempting to balance. The moral cost: still compromises strict ethical duty by not officially reporting known transgression, relies on trust in a person who has already acted unethically, places the burden of continued monitoring solely on Anya. Option C: do nothing, remain silent, prioritize loyalty, community stability. The moral cost: betrays professional ethics, allows unethical practice to continue, compromise patient welfare, financial burden, compromises her own integrity. Dr. Anya's real health decision and its ramification. After several sleepless nights and agonizing over the dilemma, Anya decides on a path that attempt to mitigate the moral cost and uphold as many of her values as possible, choosing a nuanced approach over a immediate radical one. The decision. Dr. Anya decides to privately confront Dr. Kumar first, giving him a strict ultimatum while also seeking to understand his motivations and ensuring future patient protection. Actions taken. Private direct confrontation. Anya requests a private meeting with Dr. Kumar. She presents the evidence calmly and directly, avoiding accusation but stating the facts clearly. Emotional appeal and ultimatum. She expresses her disappointment and the ethical breach, emphasizing the financial burden on the parents. She then gives him a firm ultimatum: he must stop the practice immediately and commit to prescribing only necessary cost effective medication. She makes it clear that any future recurrence will force her hand to report him formally. Seeking context without excusing. She asks if there's any underlying reason for his behavior, allowing him a chance to explain. He tearfully admits to mounting personal financial pressure due to a sick family member, not entirely justifying but explaining his actions. Implementing internal safeguards subtly. Anya discreetly implements stricter internal monitoring of prescriptions with her own patient pool and subtly educates patients to ask about generic alternatives, empowering them without directly implicating Dr. Kumar. Setting a boundary. She makes it clear to Dr. Kumar that her integrity comes first and that this is the only chance. Now, the consequences. There are some short term, there are some long term. So, the short term. Immense stress for Anya. The confrontation is emotionally draining, and she carries the burden of knowing about the transgression and the responsibility of monitoring. Dr. Kumar's shock and guilt. He is deeply shaken, realizing he's been caught. He feels immense shame and guilt. There's uncertainty, no immediate resolution, just a conditional truce. Now, the long term. Patient welfare is prioritized. Dr. Kumar, fearing exposure, immediately seizes the unethical practice. Patients receive more appropriate and cost effective treatment from him. This is a direct win for the value of patient welfare and justice. Integrity preserved with a nuance. Anya maintains her integrity by not allowing the unethical practice to continue. While she didn't formally report him, her direct intervention rectified the situation. Mentor relationship is evolved. The mentor mentee relationship shifts. There's an underlying tension, but also a newfound, albeit uncomfortable respect from Dr. Kumar for Anya's courage and integrity. Community stability is maintained. The CHC's reputation remains intact, and the community's trust in their beloved Dr. Kumar is preserved. Anya's moral growth. This difficult decision deepens Anya's understanding of ethical complexity. She learns that upholding moral principles sometimes requires nuanced, difficult interventions rather than simple denunciations. It strengthens her resolve to lead with integrity. Potential future risk unmitigated. If Dr. Kumar were to relapse, Anya would face the dilemma again, possibly with greater pressure to report. The solution relies on his compliance. The conclusion to the case study. Anya's case illustrates profound challenges of moral dilemmas where there is no perfect solution and every choice carries a moral cost. The first is conflicting loyalties. The dilemma forces a choice between loyalty to a person, institution, and duty to a principle that is greater good. Nuance over absolutes. Real life ethical decision making often requires navigating shades of grey and finding creative solutions that aim to maximize positive outcomes while minimizing harm, rather than adhering to rigid black and white rules. The weight of the choice. The individual bears the heavy moral burden of the decision and living with the chosen path and its potential unmitigated risks. It becomes a part of their character. Courage in action. It takes immense courage to confront unethical behavior, especially when it involves someone in a position of power or close personal ties. So, the crux of the case study is Anya's decision wasn't the easiest or the most legally straightforward. It was deeply moral one, reflecting her attempt to balance justice with compassion, integrity, and responsibility in a complex real world scenario. Her actions ultimately led to a better outcome for patients without devastating a valuable community member, embodying the true essence of navigating a moral dilemma.